The vertical space issue is one that everyone is familiar with. A tube guide requires you to stack the drill above the tube. The kicker is that we don't always measure the maximum inner incisal opening of our patients as part of our pre-surgical plan. And so you have situations where the issue is not appreciated until the surgical appointment, at which point the guide is discarded. But the tube guides can easily add 6, 7, 8, 9 millimeters of vertical height requirement to a case. The ThinLayer guide addresses these issues by its design. First, we provide a snug-fitting, disposable drill stop. And these are made custom for any drill system that might be used. So the first step would be to use an insert with an endo file or a sharp burr and create a bleeding point. And this replicates the ideal insertion point for the case. So you create a bleeding point. Then the drill, we use a Salvin spear drill, is inserted through the guide. The drill stop engages the guide hole, and you can now create a pilot hole. The tip of the drill goes into the bleeding point or the initial and creates a pilot hole. You then place your 2 millimeter pilot drill, and you insert the drill through the guide hole, but you can do it as an angle. So if you place it at an angle, you now require no more vertical clearance than you would freehand drilling. In other words, if the drill and the handpiece will fit in someone's mouth without a guide, it will fit in their mouth with a ThinLayer guide. So you drag the tip of the drill along the gingiva, insert it into the pilot hole, and drill to depth, as seen in the lower right panel. This procedure would then be repeated with drills of increasingly large diameters. We advocate that measurement of the patient's vertical opening should be part of the surgical plan, part of the pre-surgical workup, because this dictates whether surgery can be done or it can't be done, or if it can be done, this will dictate the length of your drill and the maximum length of the implant that you can use. And it varies for different drill systems, and it varies depending on the size of the head of your handpiece. So in this is a chart which we have constructed, and it's just a small sample of our database, where we can tell you, if you tell us, in order to use our system, we need you to give us the specs on your handpiece. And we'll measure the handpiece, we'll measure the insertion of the drill into the handpiece, and know precisely the vertical space needed for a given handpiece and a given drill. And in that way, we can tell you that if you use a drill length, in this example, a Blue Sky Bio short of 32.5 millimeters in a specific handpiece, we can say, well, under those circumstances, your maximum implant length is 10 millimeters, say. And so, again, this should be all part of pre-surgical planning. And in my experience, it has not been part of pre-surgical planning, and I think that's why in a number of these cases, the guides are discarded because of lack of vertical clearance, because this was not worked out ahead of time.